Now, Emerson said the first wealth is health. And Heather, my daughter, said the best invention this country ever created was the middle class. Now, what's the connection? That feeling of freedom and certainty and security and comfort that comes with a certain level of economic security, it is the most important factor for sustaining health. Because the most destructive factor in health is stress. We know so much more now than we knew 30 years ago about what causes disease and debilitation. We now know what happens at a biochemical and molecular level that predisposes to illness. And you'll find what the thread that runs through all of the diseases by different names, the thread that runs through all of them is what we call inflammation. And inflammation is a manifestation of stress. And we also know that adverse childhood experiences will predispose to all manner of adult diseases and pathology, and we're beginning to understand the molecular process that creates that. The short and long of it is, if we can provide the opportunity in a more equitable basis for our nation's people to realize the American dream, we will, in fact, provide more health. Now, health insurance, as important as it is not health assurance. Health care, while critical, contributes 10% to the total constellation of factors that create health. Health is determined by the environment and by the social context in which we live, and by our early experiences as human beings. And so your work of creating opportunity, economic opportunity for families, your work in sort of dismantling this stratification we have, this economic stratification, which has its roots in systems of exploitation like slavery. Your work in opening doors and creating ladders for people to climb to a realization of self is very much the work of creating health. And I'll close by suggesting that all of you read the book Blue Zones. Blue Zones is a book that was written to find out what was the secret of people who lived to be over 100 years old and were healthy and active, and the author points out sexually active. He wanted to know what was the secret. What were they doing? Most importantly, they had purpose in life. And that study parallels studies of people who live to be over 100. Most of them are self-employed. They have their own businesses, okay? But in addition to that, they had relationships that really, really mattered. Fundamentally, we are dependent human beings. This concept of independence is another myth. We as human beings need to resonate with other human beings. It's who we are. And so relationships are critical for longevity. Diet-wise, these folks ate lots and lots of vegetables, a little meat now and then, but lots and lots of vegetables. And perhaps most importantly, movement. I didn't say exercise. Movement was a critical component of their daily lives. How many of you read the story in the New York Times last week when the author identified the most destructive things we do to ourselves in terms of health? And that is, we sit on our behinds all day. Now, I could go into the physiology of that because I am a licensed physician, but let's just say the body was designed to move. And when you don't move the body, what is it? If you don't move it, you lose it. So health is our natural inheritance, but we have to be wise about protecting it and nurturing it and valuing it. By all means, everybody in this room should go out and be an ambassador for the struggle and the victory of increasing access to health care. We should be ashamed as a country that 1 in 3 in our nation do not have access to quality health care when they need it. And we should not let partisan and other types of motivations destroy that hard-fought victory. But we should also understand that the key to health and longevity and economic viability for this nation is equity and fairness and opportunity for all. Thank you.